In this video, we're going to talk about Tommy John surgery. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, the injuries that changed sports forever. I provide education and information and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. In a video not too long ago, I talked about ulnar collateral ligament injuries of the elbow, or UCL injuries. And we talked about that's a ligament on the inside of your elbow, or the medial side of your elbow, the side closest to the midline. Very common injury in baseball pitchers, but you can see it in football quarterbacks, you can see it in people that serve in tennis, volleyball, javelin throwers, in track and field, but predominantly it's baseball pitchers. And we talked about some of the treatment options and how you diagnose it, things like that. And I talked about for complete ruptures or partial ruptures that just aren't getting better, for somebody at a high level in baseball pitching or sports that need to be able to throw, surgery is sometimes required. And that leads to Tommy John surgery. That was named Tommy John surgery because of the pitcher, Tommy John, who was the first high-profile athlete to actually, and I guess really the first athlete to have surgery for that injury. Dr. Joe basically diagnosed him with that injury and tried an experimental surgery. And what that involves, it's still, that was 1974, it's still very much like the surgery was way back then. There's a few modifications, but for the most part, the surgery is still the same. And that typically is taking a tendon from the other wrist, even though I guess in theory you could take it from that wrist, and basically using it, passing it through drill holes in the bones on either side where that ligament passes, and you make a new ligament. Now, there are basically experiments going on to better develop sort of newer techniques that involve, you know, a repair and maybe putting in a collagen-filled sort of bridge to sort of help that heal. But still, most of the time, it's an ulnar collateral ligament reconstruction. That's what Tommy John surgery is. Again, tendon from the wrist, but it can be a tendon from maybe the knee or a cadaver graft. And then it's passed through those bones, held in place with screws or anchors or something like that. That surgery is an outpatient. Basically come in one morning, go home the same day. You're probably going to be in a splint or a brace, honestly, I would think for at least a couple weeks for the splint, and then maybe switch to a brace that you may have to wear for 6 weeks or 8 weeks or more. A lot of work early, allowing that ligament, that graft to basically heal, and then you start working on getting motion back. You know, over maybe 3 months or more, you start to get the motion back and you start getting strength back. And then maybe by 4.5 months, 5 months, maybe you start light tossing from the mound, and then gradually working to, you know, throwing from more and more, longer and longer distances, maybe 45 feet, and then maybe 60 feet, 75, 90, and then maybe throwing off the mound. That return to pitching or return to throwing process can take, honestly, 3 or 4 months. The overall recovery from that surgery is typically about a year. Maybe it's 10, 11 months, but it can also be 13, 14 months. It can take a while. And a lot of pitchers will tell you that it's their second season back that their elbow really feels normal. Now, that surgery has really good success rates. We think that baseball pitchers get back to the same level or even higher level of pitching at about 83% of the time. But still, that's 17% that don't. So it's not something that you want to go into lightly. And that's certainly a reason why you don't do that surgery on somebody that doesn't have that injury. This misperception that you're going to be stronger after surgery and you should get it, basically to prevent injuries and make your elbow stronger is ridiculous, because one, that's not necessary. Two, it's a preventable injury generally if you can take steps early on to prevent it from wearing out. And three, that gives you about almost a 20% chance of never getting back to play at the same level. So we don't typically do that. But if for a high-level athlete, high-level throwing athlete especially, it can have good success rates. It's just a long time to get back to that level. All right, have you had Tommy John surgery, and how did you get hurt? What was the surgery like, and what did it take for you to get back on the mound? I'd love to hear your experience, and honestly, I think viewers from all around the world would love to hear what you have to say as well. So below this video in the comments section, describe your experience so we can all learn what you went through. All right, I would love to know the number one challenge that you're dealing with, or number one frustration you're dealing with your injury. Be it a Tommy John injury or elbow injury of some other kind, whatever it is, I'd love to hear it. In the description below this video, there's a link where you can click on it and it'll take you to a page where you can describe it in as much detail as you like. I just want to better understand your injury so I can design content and programs that better help you. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. Click the subscribe button in the upper right corner of the page. I record several of these videos every single week, and I do live videos, and in some of those I answer some of your questions, so you'll get notified about those videos and you can learn and you can participate. Thank you so much for watching. I really hope this was helpful. I look forward to seeing you right here next time.